Welcome to Movement and Function. I'm Beth Wagner. Today's video is about treating tennis elbow, or as it's more formally known, lateral epicondylitis. That might be a medical diagnosis that you've received from your doctor. Tennis elbow refers to inflammation in the tendons around the outer part of the elbow, and those tendons are connected to muscles that live in the forearm and that run down into the top of the wrist here and into the hands. And those muscles perform the action of extending the wrist and the hand, like this movement. During repetitive or strenuous movements of wrist extension, the tendons end up running or rubbing over bony parts in and around the elbow and become irritated and inflamed. Step one in treating tennis elbow is to rest and to stop performing the movements that have caused the inflammation. Now, sometimes it's hard to stop those movements if they're things that are required for you to do at your job, or even things that are required during a house project or something where you're on a deadline. And if you absolutely must continue doing that work, then I also have some suggestions for you. First of all, try to change how you're performing the activity. So look at the mechanics and the ergonomics of the task that you need to do and see if there's a way for you to change your body or change the motion, change a tool in order to avoid overusing your wrist and instead to incorporate more use of your elbow, your shoulder, even your trunk and core. Using more muscles and larger muscles of your shoulder and your trunk will help balance out the action and decrease the stress and strain that are occurring right here in the forearm on these muscles. Other things you can try are to lighten the load, break up the task into multiple smaller parts, decrease the repetition of what you're doing, or try to use the other arm. Most of us are really dependent on our dominant arm, and that's typically where we see tennis elbow take place. So try to use your other arm to give your dominant arm a break. Sometimes that takes a little bit of practice and training. Most of us really are used to using our dominant arm, and our other arm is a bit slower or doesn't perform the task quite as well. But with practice, oftentimes we can strengthen that arm and become closer to ambidextrous. And that can be a big help in decreasing stress and strain from the dominant side. Now let's talk about some treatment options. First, since this is an inflammatory process, typically the area responds well to cold therapy, a cold pack or an ice massage. So you might try wrapping your elbow with a cold pack for 10 minutes. No more than 10 minutes is necessary or even helpful. You could try putting the cold pack into a pillowcase and then wrapping that pillowcase around your elbow so it's nice and snug and provides a little bit of compression, firm pressure right around your elbow. You might also extend that cold pack down into the forearm if you're feeling some of your pain down in the belly of the muscles here. A beneficial alternative to using a cold pack is an ice massage. Freeze about half a cup of water in a Dixie cup, and then peel off the top of the paper so that the ice on the top is exposed. Rub the top of the ice cube with your hand to get it to start to melt a little bit because you don't want that ice cube to stick to your elbow. Once it's starting to melt, then go ahead and massage the area that's sore right above your elbow with constant motion. Keep it moving. If you just hold it there, you can actually do some damage to your skin and start to freeze layers of your skin. You don't want to do that. You will notice 3 different sensations in your elbow. First, it'll feel cold, then it's going to start to burn, and then it'll go numb. Once it's numb, stop the massage. It takes about 3 minutes or so. I recommend using the cold pack or an ice massage 3 to 4 times a day. Since tennis elbow is an overuse injury involving inflammation, we really don't want to do a lot of exercise to that area. It's already being overused. So during the acute phases, meaning when it's really sore and when you might even be noticing that it's feeling weak because of a lot of use, we don't want to strengthen. We also don't want to overstretch any damaged areas, but a gentle stretch is okay to do. All right, so to do that stretch, you'll extend the arm that's affected out forward, bend your wrist, use the other hand to gently press down. This is a wrist extensor stretch. You might also see this written as a wrist flexion stretch, and that's simply because we're putting the wrist down into flexion. but the muscles we're stretching are the wrist extensors through here. Hold for about 20 seconds, release, shake that out, and do that 3 times. Even a 5-second stretch here during the day, during activity, can be helpful and a nice way to break up the repetitive, strenuous motion. Once you've been able to rest, apply cold packs frequently, and you've started to do some gentle stretching, and your pain subsides, then I would suggest adding in some postural and shoulder strengthening exercises. Oftentimes, these wrist extensors can become overused because of weakness in other parts of your upper body, your shoulder girdle, even your trunk and core. If you'd like to check out some of my exercises on shoulder strengthening, core stability, and thoracic spine exercises, those might be really helpful for you. I'll include links to some of those exercises down below in the description, or feel free to peruse all the videos on my channel and see what you think might be a good fit for your needs. Also, once the pain has subsided for quite a while, if you're left feeling like that muscle is just weak and does need to be strengthened, then you could start with a very specific type of strengthening program. Most of the time we think of strengthening when the muscle is contracting, like a bicep curl. We think of the muscle being strengthened during this part of the movement. But the muscle is actually strengthened during this part of the movement as well. That's the eccentric part. And when we're strengthening eccentrically, there is less strain on the tendon. That's why we use it for helping to recover from tendonitis. So to perform eccentric strengthening of your wrist extensors, with your arm straight forward and your hand down, use your other hand to lift it up in the air. Then remove that hand and slowly lower. That's the eccentric strengthening portion. Use your other hand to lift it up and then slowly lower. Continue 20 times. With just the weight of your hand, quite honestly, this is going to feel silly. It's not going to feel like you're doing much. But practice with just the weight of your hand until you get this motion down. So your other hand lifts, the hand affected slowly lowers. All right. Once you feel like you have that form down and it doesn't hurt, then try adding a light weight. Try a soup can, less than 16 ounces. Perform 20 repetitions daily with that light weight. If you still don't have any pain, then after 3 to 4 days, increase the weight to 1 pound. Again, 3 to 4 days of pain-free exercise, at least 20 repetitions, then you could increase the weight again. If at any point in time you have a flare-up, whether from doing these exercises or from your daily activities, then take a rest. Stop doing the strengthening exercises, go back to rest and ice, and then when the pain subsides again, you could return to the eccentric strengthening exercises. Finally, another thing to keep in mind is your overall posture. Make sure you're holding yourself in the position that allows your shoulder blade, your neck, your upper back to do the work they need to do in order to keep your entire upper body balanced. And that will decrease the stress and strain you feel throughout your forearm, wrist, and hand. All right, I hope these exercises and all of this information is helpful for you to treat your tennis elbow, get rid of your pain, and get you back to doing the things that you love to do every single day. If you have any questions or comments, please leave them down below and I'll get back to you as soon as I can. If you liked this video, please give it a thumbs up and consider subscribing to my channel. Here's to your healing, health, and happiness. Have a wonderful day.